This is not, a charity work type of situation. You're looking at a very talented and motivated population of people who are looking to continue to serve within their company, in their community, in some type of aspect so that they can carry that on. So it's more of a strategic advantage for organizations than it is charity work.
Welcome to the Making Waves podcast. I'm Matt Disher.
And I'm Candy Tillman.
And let's get the conversation started. Today we are joined by Chambala Roach and John Snider of HCA Healthcare. On this podcast, we talk about important topics coming out of the military and veteran community. And a lot of our conversations are based around the employers and the programs and the people that are doing great work in and among this community here in the United States. And you guys are considered leaders, and your organization expressing great leadership in and among the military and veteran community. So I thank you for joining us for this conversation today. I'm going to start with you, Chambala. If you could just go ahead and quickly introduce yourself, your affiliation to the military, and what kind of job you do at HCA.
So I'm Chambala Roach, and I am the program manager of military affairs for HCA Healthcare. Been with the company for about a year and a half and transitioned out of the Army after serving for 25 years. I was in the Army as a medic and transitioned over to being a human resources manager, and then later on was a career recruiter, where I spent the majority of my time recruiting people within the community and also trying to find people to work within our healthcare facilities as well too. So right now I have the distinct pleasure of working with people who are interested in transitioning into healthcare space in various different roles, as well as with the military spouses, those who are currently serving, and ensuring that we have a community set up for those who are in HCA Healthcare to make sure we retain them and they feel like they belong.
Thanks so much, Chambala. Thank you for your service, long service as well, in a multitude of different jobs. It's just something that we talk about quite a bit here, the different roles that we play in the armed forces through a career in the uniform. So thank you for being with us. John, love to hear how you got where you're going.
My name is John Snider. I'm the Director of Culture and Workplace Programs at HCA Healthcare out of Nashville, Tennessee. I'm a 7-year U.S. Army veteran, first enlisting right out of high school, and then spent the later half of my career as an infantry officer out of Fort Benning, Georgia. Been with the organization for 9 years, or going on 9 years. It'll be 9 years in November. I've held multiple roles within the organization, both from a clinical perspective, but also non-clinical leadership roles, helping to scale our graduate medical education function, been a part of our incident support teams with our emergency operations group, and some senior project management roles as well. In my role as the Director of Culture and Workplace Programs, I oversee our employee resource group strategy, our military affairs program, and other initiatives that helps promote belonging and creating cultures that thrive within the organization.
John, if I could just ask you, would you mind to just share a little bit about HCA Healthcare for those that may not be tracking a little bit about what the company does, how big, that type of thing?
So HCA Healthcare, we're the largest for-profit healthcare organization inside of the United States. Right now, we are just over 190 hospitals nationwide. We're spread across 20 different states and the United Kingdom. Outside of our hospitals, provide acute care services. So think about like stroke centers, chest pain, emergency care, surgeries. Outside of that, we have an ambulatory footprint of over 2,500 sites of care, which would include like your freestanding emergency rooms, your behavioral health clinics, urgent care clinics, your physician practices, and other places that you're going to get care. And so, again, we're spread across 20 different states and the United Kingdom. We're just over 311,000 employees strong, and we're delivering over 40 million patient encounters every single year to those communities.
Shambhala, can you share a little bit about the military program efforts at HCA Healthcare and how that's important to the company's mission?
Absolutely. So our programs as a whole, we have an employee resource group, which is the Military Colleague Network. So for anyone who ends up being a part of HCA Healthcare, if you're military affiliated in any way, we have a group of people across the nation who share that same background and that same level of dedication towards the organization so that you have an opportunity to come together and do different things like community service. It could be just a coffee hour. It could be where you're having that moment to break bread and get to know each other and have that camaraderie that you're missing from being within that military community. May it be with the, spouse, someone who's currently serving, as well as with those who are veterans, and they really do show up for each other in different moments. I know recently we've had someone who created care packages for one of our service members who is currently on a deployment and sent packages over to not only that person, but also their whole platoon as well too, just to make sure that, hey, HCA still remembers you as well too. So they're very much into, making sure that everybody feels welcomed and that you're, all together. But also, when we're looking at the other programs, you have like Skill Bridge. We're at that point to where we're making sure that if you're coming to our organization, it's more of a one-on-one matching system to where we're sitting down with you and trying to figure out where we can place you. Because at the end of the day, we want to make sure that we're not just giving you an opportunity to walk through the civilian sector and see what it's like to be a transitioning service member, but where do you feel like you belong in this space? Because at the end of the day, we not only are looking to hire you, but we're looking to retain you in whatever position that you're in as well. And then also with our program, we're looking at our retention strategies as well too with our service members, what it is that they need to make sure that not only are they staying with us, but can they see areas where they can grow in the future as well too, to wherever it is that their path is that they're looking for. Because I know for myself, I first came to HCA as an HR business partner and was working within a facility. I had an opportunity to work as a military colleague network chair to where I could mentor and set up different programs for the other veterans and also spouses who are within our community. And once I had an opportunity to do this, to make sure that managing everything else for the entire enterprise, I just had to, stretch out with that. And I just want to make sure that with this program as well, that we're doing that for the others.
You mentioned when you joined HCA Healthcare. Do you mind to just share a bit about how you originally found HCA Healthcare and how that came to be a really good fit for you as a starting point out of the military?
As I was transitioning out of the military, I was doing my skill bridge through College of William and Mary and was working with them. And they had a program called Flourishing Through Life Transitions. And during that time period, they had a session with you, Candy, with 50 Strong, to where you spoke to our entire cohort. Everything sounded great on that one particular briefing that you gave us. And I was like, you know what? I need to give 50 Strong a try and let's see how this works out. So 2 years ago, almost to this date, I met John Snider on the call, and we had probably a whopping 5 minutes on that call. It really wasn't all that long, but it was very impactful at that time frame. And just hearing his briefing and talking to the other different employers, I really did feel like not only was that 50 strong call very monumental for me, but when I was talking to John, I was like, HCA Healthcare is definitely where I wanted to be and been there ever since.
There used to be this thing, the 7 degrees of Kevin Bacon, that everybody somewhere in Hollywood had this connection to Kevin Bacon somehow. It's now like the 3 degrees of 50 Strong and Candy Tillman.
Yes, absolutely.
And I can't tell you how many stories I hear when people are like, somebody is asked, and they've got out of the military in the last 2 or 3 years, how did you connect to your current opportunity? And the story starts with, I came to a 50 Strong call and talked to somebody on that call. And it's this relatively small community of companies, employers, that we all know each other. We're all talking to each other. But it's so funny. It's amazing how in some cases, maybe one of us didn't hire somebody, but we made the connection to somebody else so that they did end up in the right position. So I appreciate that you said that not only is the program looking to attract the military and veteran population, a company the size of HCA Healthcare, obviously you're going to have just lots of veterans and military spouses and military family members and people connected to the military and veteran community. I think that's another population of people we don't often talk about at large. It's everybody who is connected, the family members that are alongside this population and this community. You're not only trying to attract them to hire them, but you're retaining them and working in programs that help to retain and keep them engaged. because I think one of the big topics we talk a lot about is the loss of tribe. When people are exiting the military, I always say it's like leaving a room full of everything you knew. One day you take off that uniform, you walk outside, and you have to leave that room behind. And it's sometimes tough figuring out what happens next or how you're supposed to behave, and on down to how you're supposed to dress in the workplace. It sounds funny, but coming off of a career in the military, especially if you've done, if that was your first job out of the military or out of high school, for example, or out of college, you might not have a registration of what the workplace is supposed to look and feel like, right? So I appreciate that you guys are running programs that help to coordinate the community of people who have served or their family members inside of the company. I want to move on to John real fast. John, some companies have rolled back their military programs last handful of years, and they're rolling back some of this focus. What keeps the programs at HCA Healthcare going for several years now? What is the motivation, and what's the primary realization the companies come to continue to invest in this type of work?
I think for HCA, we're constantly evolving our business, right? It's not just, how do we enhance the quality of care being delivered inside of our hospitals, but how do we scale our current healthcare model to meet the needs and evolving needs of these growing communities that we are currently in. And when I say in these evolving needs, I mean these comorbidities that we're seeing across the American population. It's no longer just the singular, hey, John has diabetes. He also has congestive heart failure. He's also in the obese category. Many of our patients are coming into our hospitals with many comorbidities that requires our healthcare colleagues to be able to meet that demand. Our program is still intact because we are looking for talent that has the values to be able to constantly ask the question why, 5 times, get to the root cause, be able to think outside the box, be able to make effective decisions as business leaders so we can continually to evolve our business. And it goes back to how we started as an organization. Hospital Corporation of America was founded in 1968. Two of our three founders were veterans. Many of the core values that we stand upon as a company over 55 years later are the same values that our military affiliated colleagues still bring to the table and show up every single day with. And I think that's truly the reason why we have not pulled back. We've constantly invested more into our programming, and because we see the value that our military affiliated talent are bringing to this organization, how it's not just impacting the patient encounter at the bedside in that moment, but how it's impacting our overall business.
I love the way you answered that question, and you brought in the impact of the business. So it's the talent piece is the one that we see outwardly focusing, right? A lot of companies, a lot of organizations focus on that talent, which is really good, but the development of that talent and the skill sets and the values that the service member bring to the organization, going back to the initial values of the founders of your company, right? I like to say in Cushman Wakefield quite often that when you hire a service member, you're getting the strong work ethic and all those values, but also that person's going to bring an element of their experience to your workplace that is not gained in other places outside of the military. And I think a final note to what you said is that your consumers, as any business in the United States, your consumers are also veterans, and they are this community as well. And they represent, I think the last notes I saw were 17 or 18 million veterans in the United States, representing over $1 trillion in consumer spend power each year. It's a significant portion of the population with significant spend power. So that's the whole community, the families and all, right? So you can unleash those values across a business. It's great for business. It's great for the organization. It's good for the culture of the organization. Dr. Roach, I want to talk about advice that you might have. One of the common themes that I encounter are companies asking, hey, if we wanted to look at having our own specialty program like military and veterans, investing in this population, if you had one or two pieces of advice for a company that was going, we want to get involved, how do we start? What would you say to them?
As far as how to start and just an advice, big or small, is definitely connect yourself with other organizations that could assist you with it, such as, your 50 Strongs and anyone else that is within that space to help you not only attract that talent, but also how to navigate that space around bringing people in. Another one is a mindset of making sure that they understand that this is not a charity work type of situation, that this is a person that is, down on their luck or, they don't have transferable skills over. You're looking at a very talented and motivated population of people who are looking to continue to serve within their company, in their community, in some type of aspect so that they can carry that on. And they also have the means to get the certifications and the education needed to continue on in various different roles in your areas. So it's more of a strategic advantage for organizations than it is charity work. So whenever you're doing that, making sure that not only are you partnering with people to help you get them there, but make sure you have a plan in place when they get there to make sure that you're elevating them, you're promoting them, and that you're also retaining them as well too.
To be honest, I've pivoted my answer to this question a little bit over the last, I would say, the last 9 months, because of just personal things that I've gone through in my, professional and personal life and how they've collided. I've been working with a handful of organizations. One, a very large healthcare company out on the West Coast, Candy's familiar with, but also some businesses within the state of Tennessee with the governor's Veteran Ready Business Recognition Program, and helping them think about how do they start these types of programs. And at HCA, we say that our services, our military affairs program that Shambhala leads, we provide two things: it's purpose and community. What I'm challenging us to take it a step further is to ensure that as Matt Disher transitions from active duty or from another part in his life, it's that we're helping Matt understand that we're helping him to find purpose, but we're also helping him to find a level of fulfillment that isn't necessarily wrapped up into who Matt is from that 8 to 5 job that he's fulfilling at HCA. That's something that I've kind of worked through in my own personal life as veterans and even our military spouse population. Who we are from that time of service, our identity was who we were in the uniform. I could take a look at your uniform and see, rows of ribbons or medals or things on your sleeve, these badges that we all earn. And I could tell you probably a 5-minute spill about who Matt Disher is. But once we take that uniform off the last time, veterans, we struggle with that identity piece, and it's so easy to get back into that routine of trying to find your next identity in the job that you're fulfilling for HCA or even Cushman and Wakefield. And so what I've challenged employers is say, hey, everybody wants to be connected with meaningful work and have a purpose that they're doing from 8 to 5. But, to take your step, your recruitment program or the transition support program that you're setting up internally, take it a step further in helping John, find where he's going to truly thrive in. What are some opportunities for, where he's going to fill his cup. And it might be in things outside of work. It might be in the volunteer activities that your company has. It might be in volunteer activities, after 5 p.m. after he logs off for the day. It might be in me becoming a better father, a husband, or getting into being a baseball and softball coach. But that's kind of what I've been challenging other employers to assist them with. It's not just helping to fill requisitions, right? It's making sure that Matt and John and Shambhala and Candy are all gonna, still standing at the end of their first year and feel like their cup is being filled, whether that's through work or through extracurricular activities.
There's this broken veteran narrative that it has existed for forever. And I think it probably started in the post-Vietnam generation, people returning with PTS and the various, hangovers of combat and exposure. And our generation of combatants, of warfighters, is not immune from this. And so the dramatics make it to the headlines, but most of us are not broken. We're slightly out of guidance for a moment, or simply back to that loss of tribe, loss of purpose piece. I use myself anecdotally. I was a sergeant in the Marines. I led Marines in training and planning, and I had, a bunch of Marines under my charge at one point in time. And then one day I took off that uniform and suddenly I didn't have that purpose anymore. I didn't suddenly know what I was talking about anymore. I came out into the civilian world. I got really good at what I did in the military, and now I'm not good at whatever it was that I was doing before. But we talk about the broken veteran narrative has to be broken. And part of that is that if we are assisting and if we are counterpart to helping people figure out what they're going to do post-military before they even take off that uniform, the broken veteran narrative largely disappears from the headlines. If we can get people paid the way they need to be paid and into fulfilling jobs and have them going to work every day and being happy, that makes them better fathers and mothers and husbands and wives, careerists, taxpayers, citizens, etc. The headline disappears. So I appreciate that you guys are having that narrative. That's something that's part of your culture, of your organization. And there are so many that are doing this as well, right? And we all do it in different ways, shapes, and forms, some better than others. But you guys, just like us, we give the advice to whoever's asking, right? If a company comes and knocks on the door and says, what do we need to be doing? We're like, here's the playbook. Take the playbook and invest in this as much as you can, fixing that broken veteran narrative.
As the lone non-veteran civilian on the call, I'll just say every time I listen to any of our partners, I learn a lot, right? Even after years of working every day in this space. And so, for others, non-veteran civilians that may be out there, these type of conversations are really important for those of us that didn't serve to understand some of the reality. And, John, I just want to highlight something that you said. You made a comment about how you've pivoted even in the last 9 to 12 months in some of your thinking. And I think this also extends on a more macro level, right? So if I think about where our country is and the way our military is engaging throughout the world, I think the work that a lot of our partners do today looks different than it did in 2020 and in 2012, and certainly versus 2006, right? And so, as you think about this kind of constant iteration toward meeting the community needs, here we are today in 2025 with the realities around us. What do you think that we as a community need to be thinking about now for those leaving service now, but in the coming years? Are there things that you're thinking about now that maybe you weren't thinking about just a few years ago?
The political landscape is interesting right now. And I think interesting is the right adjective to describe it, because I think we're all still trying to figure it out. And it is hard to anticipate and plan ahead. There is some level of pressure being put on transition programs. And, what my fear is with some of the pressures being put on, government funded transition programs, it's going to have systemic effects on that service member and their family and how they transition to the civilian workforce. I do think that many of the systemic effects will be negative in nature. I think some of them will impact some of what Matt was just talking about with feeding into the veteran population is broken. It's going to be important for the 50 strong family to come together to get ahead of this, to truly help our servicemen and women, their families, our veteran population, with their transition support. Because it's not just them transitioning from active duty. Transition doesn't stop once you land your job and you show up to HCA on day one. I'm on the north side of 10 years since I left active duty. I'm still transitioning. Many veterans that I've talked to that have been out for 5+ years are still telling me I'm still transitioning. Um, and so I think that is something that we need to get ahead of to ensure that we are meeting the transition needs of those, taking off the uniform for the very last time. And even, meeting the needs of the military community, even if they've been out for greater than 10 years, because they may have not gotten the transition support that they needed when they ETS'd, prior to 2012. The other thing that, we're thinking about, and this is where we're pouring a lot of, time and energy into, it's around apprenticeships and this on the job training that we can offer as an organization. Right now there's a war for talent. When it comes to just the healthcare talent population, our nursing schools, our medical schools are not producing enough care providers to meet the clinical demands of our growing and aging population here in America. I think we're starting to break away from thinking that, hey, all nurses need to have, X credentials, or hey, they need to have at least this certification to be able to do X, Y, and Z. Our company is heavily investing in our workforce development needs, shifting our mindset of how do we hire to meet the needs of today? How can we develop the talent that we need for tomorrow? That's our way of thinking. And so that's where we're pouring a lot more time and energy into our military affairs program, is aligning to those efforts and leveraging our Department of Defense Skill Bridge program, CSP opportunities, with the U.S. Army, all these avenues to make sure that we're helping those service members develop the skills that they need to fulfill roles that maybe we wouldn't have thought about them in, just 3 years ago. So those are kind of two big priorities for us this year of how we've shifted over the last kind of couple of years. Those are something that we, are trying to get ahead of right now.
Industry led innovation, right? And continuous improvement is a really important part of how we think about and how I think we should approach the military to civilian transition. And so, I just want to thank you all really because I think that continuous improvement of you all as key stakeholders to how we do this at scale as a country is really critical. Um, Thank you.
Yeah, and it goes without saying. I mean, John, I've been in the room with you on Capitol Hill and Candy as well, and a number of our counterparts not only sharing what we're doing as companies, but also sharing it's the bigger picture and the vision and how we support. I think of that with our partnership with 50 Strong, for example, or collective partnerships with 50 Strong. It's advantageous for us as companies. Obviously, we attract great talent through these programs. But we also get an opportunity to continue to contribute to that larger communal conversation about what has to happen in the future, so we don't have generations of military and their families getting lost post-military and in transition. But I think that takes a step further when we talk about the lapses in recruiting ability by the armed forces. They're trying to get new people in. And I've always said this, the more we do better work on the backside of military service, the more people coming into military service will largely be influenced by friends, family, pop culture to want to join the military because it's a really good opportunity. You get plugged into great opportunities in communities on the back end, like Cushman and Wakefield or HCA Healthcare, or this community of people in 50 Strong that they can plug into. I really do firmly believe, and it's a hard line to draw. It's anecdotal completely. I really do believe that that will draw more top talent to join the armed forces in the first place if we get the transition piece on the back piece the right way. And that's companies and government and service organizations, et cetera.
I agree. And to be honest, I think the DoD agrees. They will show you the data where they surveyed the GWAT era veterans and, asked like, would you recommend your son and daughter to join the armed forces? And a large percentage said absolutely not. And large part of that population were the folks that didn't get a lot of support during that transition process. So Matt, I think you're exactly right. If our government and if companies, industries can come together to provide that transition support, it does aid for a great recruitment tool to drive more young Americans to join the U.S. Armed Forces and have a positive experience while they're serving and contributing to this great country, but also, walking away with, skills, whether it's a hard technical skill or these soft skills that we, us as companies, we leverage every single day to drive innovation and business objectives and be successful for the populations that we're contributing to.
Dr. Roach, before we sign off here, anything to add? Any saved rounds and alibis?
The common thread that I've caught from this as well too is not only the importance of the military family and how they play a part in this as well too. I'm an avid believer in the fact that if we are able to make sure that we're taking care of the military spouses and their families, that's going to help in retention in any avenue where we're in. If that is in the military and that there are opportunities in that civilian sector for those spouses, that's going to help that service member feel more comfortable staying wherever they're at, but also on that transition space too, because wherever that military spouse feels welcome, that's where that service member may also want to follow as well too. So, the power of that with the military spouse is definitely key when it comes to any of this, when it comes to the transition for the entire family, but also innovation as well too, where, as a service member, you can't accept defeat. You can't quit. You have to make that mission. That is not an option not to accomplish your mission, and understanding that that comes from innovation. They had to find a way to make it work. And why wouldn't you want someone who is highly educated and resilient and innovative within your organization. So if you're trying to go to a whole nother level, that's where you want to be, is definitely leaning on your military talent.
I really love the fact that in the last little bit, as I think about through our conversation, we have used words like innovation, solutioning, business results, right? And I really love that we're having this conversation together in the context of what drives business performance and what is good for our community. And I think those can coexist as you are proving every day. So thank you so much for that.
If somebody wants to get in touch with your program, Dr. Roach, a veteran or a military spouse, how do they find you?
I'm on LinkedIn, so LinkedIn's a good space for you to contact me, and the message is right there, and also I keep a tab on there for careers as well too. So it'll be a great spot to connect with me.
Awesome. And then, of course, I think we're all regularly on the 50 Strong calls on a regular basis, where we are imparting our respective advice in our breakout rooms to a great population of active duty and veteran service members and their spouses and their family members who are trying to connect to these great opportunities with these companies around the United States. Thank you both for joining us today, Dr. Roach, John. This is the Making Waves podcast, sponsored by Cushman & Wakefield. We'll see you next time. If you like Making Waves, subscribe wherever you listen to podcasts. Find 50 Strong and Cushman & Wakefield on the internet, or find us on LinkedIn.